Hi, everyone. This is Nurse Anna from nursestudy.net, and today we're going to be doing our first set of SATA and case study questions. This time we're going to hit the GI system and see how you guys like the set. Enjoy. Before I forget, I do have free audiobooks via A6 Audible. All you need to do is look at the link in the description, and it's a free 30-day trial. You can get through the book within the 30 days. So please utilize this to get more questions for NCLEX NGN that you can listen to in your car or in the library.
Question 1. SATA. Scenario: a client with acute pancreatitis is admitted with severe abdominal pain, nausea, and vomiting. The nurse is planning care. Which nursing interventions should the nurse prioritize? Select all that apply. A. Place the client in a supine position. B. Administer prescribed IV fluids. C. Monitor serum amylase and lipase levels. D. Initiate nasogastric (NG) suction as prescribed. E. Encourage a high-fat diet. Correct answers: B, C, D. Detailed rationales. A. Place the client in a supine position. Why incorrect? The supine position can increase abdominal pressure and exacerbate pain in pancreatitis. What to do instead: position the client in a semi-Fowler's or side-lying position to alleviate pressure and pain. B. Administer prescribed IV fluids. Why correct? IV fluids are critical in managing dehydration and restoring intravascular volume, which are common in acute pancreatitis. How it helps: maintains hemodynamic stability and prevents complications like hypovolemic shock. C. Monitor serum amylase and lipase levels. Why correct? Elevated amylase and lipase levels are key diagnostic markers for acute pancreatitis and guide ongoing management. How it helps: tracking these levels helps assess the progression or resolution of the condition. D. Initiate nasogastric (NG) suction as prescribed. Why correct? NG suction reduces gastric secretions, minimizing stimulation of the pancreas and relieving nausea/vomiting. How it helps: prevents complications such as aspiration and further pancreatic inflammation. E. Encourage a high-fat diet. Why incorrect? High-fat diets stimulate pancreatic enzyme production, worsening the condition. What to do instead: the client should remain NPO initially, transitioning to low-fat enteral nutrition as tolerated. Question 2. Case study. Scenario: a client with upper gastrointestinal bleeding is admitted with hematemesis, a heart rate of 110, and a blood pressure of 88/60 mm of mercury. What is the nurse's priority action? A. Administer prescribed IV pantoprazole. B. Obtain a stat complete blood count (CBC). C. Prepare the client for an upper endoscopy. D. Administer 1 liter of normal saline as prescribed. Correct answer: D. Detailed rationales. A. Administer prescribed IV pantoprazole. Why incorrect? While pantoprazole helps reduce gastric acid secretion, it is not the priority in managing hemodynamic instability. What to do instead: stabilize the client's circulation first. B. Obtain a stat complete blood count (CBC). Why incorrect? A CBC is essential for assessing blood loss but does not immediately address hemodynamic compromise. What to do instead: prioritize interventions that restore perfusion. C. Prepare the client for an upper endoscopy. Why incorrect? Endoscopy is necessary to identify and manage the source of bleeding but is not the immediate priority in a hemodynamically unstable client. What to do instead: stabilize the client before diagnostic procedures. D. Administer 1 liter of normal saline as prescribed. Why correct? Rapid fluid resuscitation is critical for restoring intravascular volume and perfusion in clients with hypovolemic shock. How it helps: improves blood pressure and tissue perfusion, preventing organ damage. Question 3. SATA. Scenario: a client with inflammatory bowel disease (IBD) presents with severe diarrhea, weight loss, and abdominal cramping. Which nursing interventions should the nurse implement? Select all that apply. A. Administer prescribed corticosteroids. B. Monitor for signs of infection. C. Encourage a high-fiber diet. D. Record daily weights. E. Assess for electrolyte imbalances. Correct answers: A, B, D, E. Detailed rationales. A. Administer prescribed corticosteroids. Why correct? Corticosteroids reduce inflammation during acute IBD exacerbations. How it helps: decreases symptoms such as diarrhea and abdominal cramping. B. Monitor for signs of infection. Why correct? Clients with IBD are at higher risk for infections due to immunosuppressive therapy. How it helps: early detection and treatment prevent sepsis and other complications. C. Encourage a high-fiber diet. Why incorrect? High-fiber diets can worsen symptoms in clients with active IBD. What to do instead: recommend a low-residue diet during flares. D. Record daily weights. Why correct? Monitoring weight helps assess nutritional status and the severity of fluid loss. How it helps: guides interventions to prevent malnutrition and dehydration. E. Assess for electrolyte imbalances. Why correct? Severe diarrhea can lead to significant electrolyte disturbances. How it helps: timely correction of imbalances prevents arrhythmias and other complications. Question 4, Case Study. Scenario: a client who underwent a partial colectomy is reporting increasing abdominal pain, distension, and no passage of gas or stool for 24 hours. What is the nurse's priority action? A. Notify the healthcare provider of potential bowel obstruction. B. Administer prescribed IV analgesics. C. Encourage ambulation to stimulate peristalsis. D. Obtain a SATA abdominal X-ray as ordered. Correct answer: A. Detailed rationales. A. Notify the healthcare provider of potential bowel obstruction. Why correct? These symptoms suggest a postoperative ileus or bowel obstruction, requiring immediate medical evaluation. How it helps: ensures timely diagnosis and treatment, preventing complications like bowel perforation. B. Administer prescribed IV analgesics. Why incorrect? While managing pain is important, it does not address the underlying cause. What to do instead: investigate and treat the suspected obstruction. C. Encourage ambulation to stimulate peristalsis. Why incorrect? Ambulation may help in cases of mild ileus, but is not effective or safe if obstruction is suspected. What to do instead: seek immediate medical intervention. D. Obtain a SATA abdominal X-ray as ordered. Why incorrect? Diagnostic imaging is essential, but should be coordinated after notifying the provider. What to do instead: prioritize communication to ensure prompt action. Question 5, SATA. Scenario: a client with cirrhosis and esophageal varices is admitted with hematemesis and hypotension. Which nursing interventions should the nurse implement? Select all that apply. A. Prepare to administer prescribed octreotide. B. Insert a nasogastric tube for lavage. C. Monitor for signs of hepatic encephalopathy. D. Place the client in Trendelenburg position. E. Establish large bore IV access. Question 5. Correct answers: A, C, E. Detailed rationales. A. Prepare to administer prescribed octreotide. Why correct? Octreotide reduces portal hypertension and the risk of further bleeding from esophageal varices. How it helps: controls bleeding while preparing the client for definitive treatment like endoscopy. B. Insert a nasogastric tube for lavage. Why incorrect? NG tube insertion is contraindicated in clients with esophageal varices due to the risk of trauma and worsening bleeding. What to do instead: use less invasive measures to manage bleeding. C. Monitor for signs of hepatic encephalopathy. Why correct? Bleeding can exacerbate hepatic encephalopathy due to increased ammonia from blood breakdown. How it helps: early detection prevents worsening neurological symptoms. D. Place the client in Trendelenburg position. Why incorrect? Trendelenburg may increase pressure in the portal vein and worsen bleeding. What to do instead: maintain a supine position with the head elevated. E. Establish large bore IV access. Why correct? Rapid IV access is necessary for fluid resuscitation and blood product administration. How it helps: supports hemodynamic stabilization. Question 6, Case Study. Scenario: a client with ulcerative colitis reports severe abdominal pain, fever, and a sudden cessation of diarrhea. On examination, the abdomen is distended and tender. What is the nurse's priority action? A. Notify the healthcare provider of suspected toxic megacolon. B. Administer prescribed pain medication. C. Prepare the client for a colonoscopy. D. Encourage the client to ambulate. Correct answer: A. Detailed rationales. A. Notify the healthcare provider of suspected toxic megacolon. Why correct? These symptoms indicate a potential life-threatening complication of ulcerative colitis requiring immediate intervention. How it helps: early diagnosis and treatment prevent bowel perforation and sepsis. B. Administer prescribed pain medication. Why incorrect? Pain management is necessary but secondary to addressing the underlying emergency. What to do instead: address the root cause of the symptoms first. C. Prepare the client for a colonoscopy. Why incorrect? Colonoscopy is contraindicated in acute cases of toxic megacolon due to the risk of perforation. What to do instead: imaging studies, i.e., X-ray, are safer for diagnosis. D. Encourage the client to ambulate. Why incorrect? Ambulation can exacerbate symptoms and should be avoided in clients with suspected toxic megacolon. What to do instead: keep the client on bed rest and provide supportive care. Question 7, SATA. Scenario: a client with a gastric ulcer is admitted with black, tarry stools and mild hypotension. Which nursing intervention should the nurse prioritize? Select all that apply. A. Administer prescribed proton pump inhibitors, PPIs. B. Monitor hemoglobin and hematocrit levels. C. Perform a digital rectal examination to confirm melena. D. Maintain the client on NPO status. E. Assess for orthostatic hypotension. Correct answers: A, B, D, E. Detailed rationales. A. Administer prescribed proton pump inhibitors, PPIs. Why correct? PPIs reduce gastric acid secretion, promoting healing of ulcers and minimizing further bleeding. How it helps: decreases irritation and risk of rebleeding. B. Monitor hemoglobin and hematocrit levels. Why correct? Monitoring these values helps assess the extent of blood loss. How it helps: guides decisions on blood transfusions and further interventions. C. Perform a digital rectal examination to confirm melena. Why incorrect? Melena is already indicated by the clinical presentation, and this invasive test is unnecessary. What to do instead: focus on stabilizing the client. D. Maintain the client on NPO status. Why correct? Keeping the client NPO prevents stimulation of gastric acid and allows for potential procedures. How it helps: prepares the client for endoscopy if needed. E. Assess for orthostatic hypotension. Why correct? Hypotension is a sign of volume depletion, which requires prompt correction. How it helps: early identification prevents complications such as shock. Question 8, Case Study. Scenario: a client with severe gastroesophageal reflux disease, GERD, reports persistent chest pain despite taking prescribed antacids. The nurse should first: A. Notify the healthcare provider of potential cardiac involvement. B. Educate the client on avoiding trigger foods. C. Assess the client's vital signs and perform a focused cardiac assessment. D. Administer an additional dose of prescribed antacids. Correct answer, C. Detailed rationales. A. Notify the healthcare provider of potential cardiac involvement. Why incorrect? While cardiac involvement is a concern, the nurse should first gather more data. What to do instead? Perform an assessment to determine the need for escalation. B. Educate the client on avoiding trigger foods. Why incorrect? Client education is important but not a priority when pain is severe. What to do instead? Address the immediate symptoms first. C. Assess the client's vital signs and perform a focused cardiac assessment. Why correct? Chest pain can mimic cardiac issues, and distinguishing GERD from cardiac causes is crucial. How it helps: ensures timely intervention if cardiac involvement is suspected. D. Administer an additional dose of prescribed antacids. Why incorrect? Additional antacids may not relieve the pain and delay critical assessment. What to do instead? Prioritize diagnostic evaluation. Question 9, SATA. Scenario: a client is admitted with gastrointestinal perforation. Which nursing interventions should the nurse implement immediately? Select all that apply. A. Administer prescribed IV antibiotics. B. Monitor for signs of sepsis. C. Prepare the client for surgery. D. Encourage oral fluid intake. E. Insert a nasogastric tube as ordered. Correct answers: A, B, C, E. Detailed rationales. A. Administer prescribed IV antibiotics. Why correct? Perforation can lead to peritonitis, and antibiotics are crucial to control infection. How it helps: reduces the risk of sepsis. B. Monitor for signs of sepsis. Why correct? Perforation increases the risk of systemic infection. How it helps: early detection ensures prompt intervention. C. Prepare the client for surgery. Why correct? Surgery is often necessary to repair the perforation. How it helps: addresses the root cause of the condition. D. Encourage oral fluid intake. Why incorrect? Oral intake is contraindicated in perforation due to the risk of worsening peritonitis. What to do instead? Maintain NPO status. E. Insert a nasogastric tube as ordered. Why correct? NG tube insertion helps decompress the stomach, reducing pressure and risk of further leakage. How it helps: prevents additional complications. Question 10, Case Study. Scenario: a client with chronic liver failure is admitted with jaundice, peripheral edema, and confusion. The nurse notes an ammonia level of 125 micrograms per deciliter. What is the nurse's priority intervention? A. Administer prescribed lactulose. B. Place the client in a side-lying position. C. Assess for signs of bleeding. D. Restrict dietary protein. Correct answer: A. Detailed rationales. A. Administer prescribed lactulose. Why correct? Lactulose is used to reduce elevated ammonia levels by promoting excretion through stool, which addresses hepatic encephalopathy. How it helps: decreases confusion and prevents worsening neurological symptoms. B. Place the client in a side-lying position. Why incorrect? Although positioning may be helpful for comfort, it does not address the underlying cause of the confusion. What to do instead? Treat the elevated ammonia level first. C. Assess for signs of bleeding. Why incorrect? Bleeding is a concern in liver failure, but the priority in this scenario is managing the acute issue of hepatic encephalopathy. What to do instead? Monitor bleeding after addressing the immediate problem. D. Restrict dietary protein. Why incorrect? While protein restriction may help in certain cases of hepatic encephalopathy, it is not the first-line intervention. What to do instead? Administer lactulose to lower ammonia levels effectively. Question 11, SATA. Scenario: a client is admitted with suspected gastrointestinal bleeding and reports feeling lightheaded. Which assessments and interventions should the nurse prioritize? Select all that apply. A. Assess stool for occult blood. B. Monitor vital signs every 15 minutes. C. Administer oxygen therapy as prescribed. D. Establish IV access with a 22-gauge catheter. E. Prepare for blood transfusion as ordered. Correct answers: A, B, C, E. Detailed rationales. A. Assess stool for occult blood. Why correct? Testing stool for occult blood helps confirm the source of gastrointestinal bleeding. How it helps guides further diagnostic and therapeutic interventions. B. Monitor vital signs every 15 minutes. Why correct? Frequent monitoring allows for early detection of hemodynamic instability, such as shock. How it helps guides fluid resuscitation and other interventions. C. Administer oxygen therapy as prescribed. Why correct? Oxygen supports tissue perfusion, especially in cases of anemia due to blood loss. How it helps reduces the risk of hypoxia and organ dysfunction. D. Establish IV access with a 22-gauge catheter. Why incorrect? Large bore IV access, e.g., 18-gauge, is preferred for fluid resuscitation and blood transfusion. What to do instead? Insert a large bore catheter to facilitate rapid fluid replacement. E. Prepare for blood transfusion as ordered. Why correct? Blood transfusion may be necessary to restore hemoglobin levels in significant bleeding. How it helps stabilizes the client and prevents complications of severe anemia. Question 12, Case Study. Scenario: a client with Crohn's disease is admitted with severe abdominal cramping and diarrhea. The client reports consuming nonsteroidal anti-inflammatory drugs, NSAIDs, for joint pain. What is the nurse's priority action? A. Administer prescribed antidiarrheal medication. B. Notify the healthcare provider about NSAID use. C. Obtain a stool sample for culture and sensitivity. D. Encourage the client to increase oral fluid intake. Correct answer: B. Detailed rationales. A. Administer prescribed antidiarrheal medication. Why incorrect? Antidiarrheal medication may mask symptoms of infection or obstruction and should be used cautiously. What to do instead? Address the underlying cause of the exacerbation. B. Notify the healthcare provider about NSAID use. Why correct? NSAIDs can worsen Crohn's disease symptoms by increasing intestinal inflammation. How it helps: the healthcare provider may discontinue NSAIDs and adjust the client's treatment plan. C. Obtain a stool sample for culture and sensitivity. Why incorrect? Stool testing is not the immediate priority unless infection is suspected. What to do instead? Focus on factors directly exacerbating the disease. D. Encourage the client to increase oral fluid intake. Why incorrect? While fluid intake is important, it does not address the exacerbation of Crohn's disease. What to do instead? Prioritize notifying the provider to address the NSAID use. Question 13, SATA. Scenario: a client recovering from abdominal surgery develops signs of paralytic ileus. Which nursing interventions should the nurse implement? Select all that apply. A. Keep the client NPO. B. Insert a nasogastric tube as prescribed. C. Encourage high-fiber foods. D. Monitor for bowel sounds every 4 hours. E. Administer prescribed antiemetics. Correct answers: A, B, D, E. Detailed rationales. A. Keep the client NPO. Why correct? NPO status prevents further stress on the bowel and reduces the risk of vomiting. How it helps: supports bowel rest and recovery. B. Insert a nasogastric tube as prescribed. Why correct? NG tube decompression relieves abdominal distension and prevents complications like aspiration. How it helps: promotes client comfort and reduces nausea. C. Encourage high-fiber foods. Why incorrect? High-fiber foods can exacerbate the condition by increasing bowel workload. What to do instead: maintain NPO status and follow prescribed diet progression. D. Monitor for bowel sounds every 4 hours. Why correct? Regular assessment helps track the return of peristalsis. How it helps: guides decision-making about advancing the client's diet. E. Administer prescribed antiemetics. Why correct? Antiemetics help manage nausea and vomiting, which are common with paralytic ileus. How it helps: improves client comfort and prevents dehydration. Question 14, Case Study. Scenario: a client with diverticulitis presents with fever, left lower quadrant pain, and a white blood cell count of 18,000. What is the nurse's priority action? A. Encourage the client to eat a high-fiber diet. B. Administer prescribed IV antibiotics. C. Apply heat to the abdomen. D. Monitor for signs of perforation. Correct answer, B. Detailed rationales. A. Encourage the client to eat a high-fiber diet. Why incorrect? A high-fiber diet is contraindicated during acute diverticulitis due to the risk of worsening inflammation. What to do instead: focus on bowel rest and managing infection. B. Administer prescribed IV antibiotics. Why correct? Antibiotics treat the underlying bacterial infection, causing inflammation and systemic symptoms. How it helps: reduces the risk of complications like abscess or sepsis. C. Apply heat to the abdomen. Why incorrect? Heat may increase the risk of rupture by exacerbating inflammation. What to do instead: avoid applying heat and monitor closely for complications. D. Monitor for signs of perforation. Why incorrect? Monitoring is essential but secondary to treating the infection. What to do instead: administer antibiotics first and remain vigilant for signs of perforation. Question 15, SATA. Scenario: a client with acute cholecystitis presents with right upper quadrant pain, nausea, and vomiting. Which nursing interventions should the nurse implement? Select all that apply. A. Administer prescribed IV fluids. B. Monitor for signs of bile duct obstruction. C. Encourage a low-fat diet. D. Apply a heating pad to the abdomen. E. Administer prescribed analgesics. Correct answers: A, B, E. Detailed rationales. A. Administer prescribed IV fluids. Why correct? IV fluids prevent dehydration caused by vomiting and reduced oral intake. How it helps: supports hemodynamic stability and prevents complications. B. Monitor for signs of bile duct obstruction. Why correct? Bile duct obstruction, a possible complication of cholecystitis, can lead to jaundice and worsening pain. How it helps: early detection allows for timely medical or surgical intervention. C. Encourage a low-fat diet. Why incorrect? A low-fat diet is recommended long-term but is not appropriate during acute inflammation when the client may need to remain NPO. What to do instead: maintain NPO status initially. D. Apply a heating pad to the abdomen. Why incorrect? Heat application is contraindicated as it may exacerbate inflammation or rupture of the gallbladder. What to do instead: focus on pain relief and monitoring. E. Administer prescribed analgesics. Why correct? Analgesics help manage severe pain associated with acute cholecystitis. How it helps: improves client comfort and promotes participation in care. Question 16, Case Study. Scenario: a client recovering from gastric surgery develops sudden abdominal pain, fever, and tachycardia. The nurse notes absent bowel sounds and a rigid abdomen. What is the nurse's priority action? A. Notify the healthcare provider of suspected peritonitis. B. Administer prescribed pain medication. C. Place the client in a supine position. D. Encourage ambulation to promote peristalsis. Correct answer: A. Detailed rationales. A. Notify the healthcare provider of suspected peritonitis. Why correct? Abdominal rigidity and absent bowel sounds suggest peritonitis, a life-threatening complication requiring immediate intervention. How it helps: ensures timely diagnostic tests and treatment, such as surgery or antibiotics. B. Administer prescribed pain medication. Why incorrect? Pain management is important but secondary to addressing the underlying cause. What to do instead: focus on diagnosing and treating the peritonitis. C. Place the client in a supine position. Why incorrect? Positioning does not address the medical emergency. What to do instead: notify the provider and prepare for further interventions. D. Encourage ambulation to promote peristalsis. Why incorrect? Ambulation is inappropriate in a client with suspected peritonitis and could worsen the condition. What to do instead: keep the client at rest and escalate care. Question 17, SATA. Scenario: a client with peptic ulcer disease is admitted with complaints of sudden severe abdominal pain and a rigid abdomen. Which actions should the nurse implement? Select all that apply. A. Keep the client NPO. B. Prepare the client for emergency surgery. C. Administer prescribed antacids. D. Place a nasogastric tube as ordered. E. Administer prescribed IV antibiotics. Correct answers: A, B, D, E. Detailed rationales. A. Keep the client NPO. Why correct? NPO status prevents further irritation of the gastrointestinal tract and prepares the client for surgery. How it helps: reduces risk and allows for medical procedures. B. Prepare the client for emergency surgery. Why correct? The symptoms indicate possible perforation, requiring surgical intervention. How it helps: prevents complications like peritonitis and sepsis. C. Administer prescribed antacids. Why incorrect? Antacids are not appropriate in acute perforation and delay necessary care. What to do instead: prioritize surgical preparation and stabilization. D. Place a nasogastric tube as ordered. Why correct? NG tube decompression helps reduce gastric pressure and prevent further leakage. How it helps: prepares the client for surgery and reduces discomfort. E. Administer prescribed IV antibiotics. Why correct? Antibiotics are essential to prevent or treat peritonitis secondary to perforation. How it helps: reduces the risk of systemic infection. Question 18, case study. Scenario: a client with esophageal cancer is receiving total parenteral nutrition, TPN, postoperatively. The nurse notices that the TPN bag is almost empty, but no replacement bag is available. What is the nurse's priority action? A. Notify the pharmacy for an immediate replacement. B. Slow the infusion rate to make the TPN last longer. C. Hang a bag of 10% dextrose until TPN is available. D. Flush the line with normal saline and discontinue the infusion. Correct answer: C. Detailed rationales. A. Notify the pharmacy for an immediate replacement. Why incorrect? While this is necessary, it does not address the immediate risk of hypoglycemia due to the abrupt discontinuation of TPN. What to do instead: provide an alternative glucose source until TPN is replaced. B. Slow the infusion rate to make the TPN last longer. Why incorrect? Slowing the rate can lead to inadequate caloric and nutrient delivery and does not prevent hypoglycemia. What to do instead: use dextrose to maintain glucose levels. C. Hang a bag of 10% dextrose until TPN is available. Why correct? 10% dextrose prevents hypoglycemia, which can occur when TPN is abruptly stopped. How it helps: maintains blood glucose levels while awaiting the replacement bag. D. Flush the line with normal saline and discontinue the infusion. Why incorrect? Discontinuing TPN without replacing glucose risks hypoglycemia. What to do instead: use dextrose as a temporary measure. Question 19, SATA. Scenario: a client with gastroesophageal reflux disease, GERD, reports symptoms of regurgitation and nighttime coughing. Which nursing actions should the nurse include in the care plan? Select all that apply. A. Elevate the head of the bed. B. Encourage small, frequent meals. C. Advise the client to avoid eating before bedtime. D. Suggest wearing tight-fitting clothing for support. E. Administer prescribed proton pump inhibitors, PPIs. Correct answers: A, B, C, E. Detailed rationales. A. Elevate the head of the bed. Why correct? Elevation reduces the risk of acid reflux during sleep. How it helps: alleviates nighttime symptoms like regurgitation and coughing. B. Encourage small, frequent meals. Why correct? Smaller meals reduce gastric pressure and the risk of reflux. How it helps: prevents symptom exacerbation. C. Advise the client to avoid eating before bedtime. Why correct? Eating before bedtime increases reflux risk by delaying gastric emptying. How it helps: improves nighttime comfort. D. Suggest wearing tight-fitting clothing for support. Why incorrect? Tight clothing increases abdominal pressure, worsening GERD symptoms. What to do instead: recommend loose, comfortable clothing. E. Administer prescribed proton pump inhibitors, PPIs. Why correct? PPIs reduce gastric acid production, a key factor in GERD. How it helps: provides symptom relief and promotes esophageal healing. Question 20, case study. Scenario: a client with a history of alcohol use disorder is admitted with acute pancreatitis. They report severe epigastric pain radiating to the back and vomiting. Their vital signs are BP 90/60 mm of mercury, heart rate 120 beats per minute, respiratory rate 24 breaths per minute. What is the nurse's priority action? A. Administer prescribed IV fluids. B. Obtain a stat serum calcium level. C. Administer prescribed pain medication. D. Place the client in a supine position. Correct answer: A. Detailed rationales. A. Administer prescribed IV fluids. Why correct? Clients with acute pancreatitis are at high risk for hypovolemic shock due to fluid shifts into the retroperitoneal space. IV fluids restore intravascular volume. How it helps: stabilizes blood pressure, improves perfusion, and prevents shock. B. Obtain a stat serum calcium level. Why incorrect? Monitoring calcium is essential because hypocalcemia is a complication of pancreatitis, but it is not the priority in hemodynamic instability. What to do instead: stabilize the client first. C. Administer prescribed pain medication. Why incorrect? Pain control is important but secondary to addressing the client's circulatory compromise. What to do instead: focus on fluid resuscitation before administering analgesics. D. Place the client in a supine position. Why incorrect? The supine position can exacerbate abdominal pain in pancreatitis. What to do instead: position the client for comfort, such as semi-Fowlers or leaning forward. Question 21, SATA. Scenario: a client is admitted with a suspected small bowel obstruction. The nurse assesses abdominal distension, nausea, and vomiting of bile. Which intervention should the nurse prioritize? Select all that apply. A. Keep the client NPO. B. Administer prescribed antiemetics. C. Encourage oral fluids to prevent dehydration. D. Insert a nasogastric tube as prescribed. E. Monitor intake and output closely. Correct answers: A, B, D, E. Detailed rationales. A. Keep the client NPO. Why correct? NPO status prevents further bowel distension and prepares the client for potential surgery. How it helps: reduces complications like aspiration or worsening obstruction. B. Administer prescribed antiemetics. Why correct? Antiemetics alleviate nausea and prevent dehydration caused by vomiting. How it helps: improves comfort and reduces risk of electrolyte imbalances. C. Encourage oral fluids to prevent dehydration. Why incorrect? Oral fluids are contraindicated in bowel obstruction due to the risk of worsening distension. What to do instead: use IV fluids to prevent dehydration. D. Insert a nasogastric tube as prescribed. Why correct? NG decompression alleviates vomiting and reduces abdominal distension. How it helps: promotes comfort and reduces pressure on the bowel. E. Monitor intake and output closely. Why correct? Monitoring helps assess fluid balance and detect complications like dehydration or renal impairment. How it helps: guides the effectiveness of interventions. Question 22, Case Study. Scenario: a client is recovering from laparoscopic appendectomy for a ruptured appendix. They report increasing pain, fever, and redness at the incision site. What is the nurse's priority action? A. Notify the healthcare provider of suspected infection. B. Administer prescribed pain medication. C. Apply a warm compress to the incision site. D. Encourage the client to ambulate. Correct answer, A. Detailed rationales. A. Notify the healthcare provider of suspected infection. Why correct? The symptoms indicate a possible postoperative wound infection, requiring prompt evaluation and treatment. How it helps: ensures timely administration of antibiotics or other interventions. B. Administer prescribed pain medication. Why incorrect? Pain management does not address the underlying cause of the fever and redness. What to do instead: treat the suspected infection first. C. Apply a warm compress to the incision site. Why incorrect? Heat may worsen inflammation and is not appropriate without confirming infection. What to do instead: focus on obtaining medical orders and further evaluation. D. Encourage the client to ambulate. Why incorrect? Ambulation may improve circulation but does not address the infection. What to do instead: notify the provider to address the infection promptly. Question 23, SATA. Scenario: a client with hepatic encephalopathy is admitted with confusion and lethargy. The ammonia level is 150 micrograms per deciliter. Which interventions should the nurse implement? Select all that apply. A. Administer prescribed lactulose. B. Monitor for signs of hysterexis. C. Restrict dietary protein intake. D. Encourage the client to increase fluid intake. E. Assess for signs of gastrointestinal bleeding. Correct answers: A, B, E. Detailed rationales. A. Administer prescribed lactulose. Why correct? Lactulose reduces serum ammonia levels by promoting excretion through stool. How it helps: improves cognitive function and prevents further neurological deterioration. B. Monitor for signs of hysterexis. Why correct? Hysterexis, flapping tremor, is a key sign of worsening hepatic encephalopathy. How it helps: early detection allows for prompt intervention. C. Restrict dietary protein intake. Why incorrect? Protein restriction is not universally recommended and may lead to malnutrition. Dietary changes should be individualized. What to do instead: collaborate with a dietitian for an appropriate plan. D. Encourage the client to increase fluid intake. Why incorrect? Fluid intake should be carefully monitored to prevent volume overload, especially in clients with liver disease. What to do instead: provide fluids as prescribed. E. Assess for signs of gastrointestinal bleeding. Why correct? GI bleeding can exacerbate hepatic encephalopathy by increasing ammonia levels. How it helps: prevents worsening of neurological symptoms. Question 24, Case Study. Scenario: a client with ulcerative colitis is admitted with 12 loose, bloody stools per day, tachycardia, and abdominal tenderness. What is the nurse's priority intervention? A. Administer prescribed IV corticosteroids. B. Encourage the client to drink clear fluids. C. Perform a digital rectal examination. D. Notify the healthcare provider of suspected toxic megacolon. Correct answer, A. Detailed rationales. A. Administer prescribed IV corticosteroids. Why correct? Corticosteroids reduce inflammation during acute exacerbations of ulcerative colitis. How it helps: controls symptoms and prevents complications like toxic megacolon. B. Encourage the client to drink clear fluids. Why incorrect? While hydration is important, it does not address the severe inflammation causing symptoms. What to do instead: focus on reducing inflammation first. C. Perform a digital rectal examination. Why incorrect? This is not indicated unless there are other signs requiring it, such as suspected obstruction. What to do instead: manage the acute exacerbation. D. Notify the healthcare provider of suspected toxic megacolon. Why incorrect? Toxic megacolon is a potential complication but is not indicated in this scenario. What to do instead: treat the exacerbation and monitor for further complications. Question 25, SATA. Scenario: a client with irritable bowel syndrome (IBS) is admitted with complaints of cramping, bloating, and diarrhea. Which nursing interventions should the nurse implement? Select all that apply. A. Encourage the client to keep a food diary. B. Administer prescribed antispasmodic medications. C. Educate the client about a high-fat diet. D. Encourage fluid intake of at least 2 liters per day. E. Advise the client to consume probiotics. Correct answers: A, B, D, E. Detailed rationales. A. Encourage the client to keep a food diary. Why correct? A food diary helps identify triggers for IBS symptoms, such as specific foods or stressors. How it helps: guides dietary and lifestyle modifications to prevent symptom exacerbation. B. Administer prescribed antispasmodic medications. Why correct? Antispasmodics reduce abdominal cramping by relaxing smooth muscles. How it helps: improves the client's comfort and reduces the frequency of symptoms. C. Educate the client about a high-fat diet. Why incorrect? High-fat diets can worsen IBS symptoms by increasing gut motility. What to do instead: recommend a balanced diet low in fats and rich in fiber as tolerated. D. Encourage fluid intake of at least 2 liters per day. Why correct? Adequate hydration is essential, especially if the client has diarrhea, to prevent dehydration. How it helps: supports overall gastrointestinal health. E. Advise the client to consume probiotics. Why correct? Probiotics help balance gut flora, potentially reducing IBS symptoms like bloating and diarrhea. How it helps: improves gastrointestinal function and reduces discomfort. Question 26, Case Study. Scenario: a client with gastric cancer is undergoing chemotherapy and reports severe nausea, poor appetite, and weight loss of 5 pounds in 1 week. What is the nurse's priority intervention? A. Administer prescribed antiemetic medication before meals. B. Encourage the client to consume high-calorie snacks. C. Consult with a dietitian for nutritional support. D. Monitor for signs of dehydration. Correct answer: A. Detailed rationales. A. Administer prescribed antiemetic medication before meals. Why correct? Controlling nausea improves the client's ability to eat and maintain nutritional intake. How it helps: enhances the client's appetite and prevents further weight loss. B. Encourage the client to consume high-calorie snacks. Why incorrect? While this is important, the client may not tolerate food if nausea is not managed. What to do instead: administer antiemetics first to improve tolerance for oral intake. C. Consult with a dietitian for nutritional support. Why incorrect? Collaboration with a dietitian is important but secondary to addressing the immediate issue of nausea. What to do instead: treat the nausea first, then involve the dietitian. D. Monitor for signs of dehydration. Why incorrect? Dehydration monitoring is important but does not address the root cause of the client's weight loss and poor intake. What to do instead: focus on controlling symptoms to improve intake. Question 27, SATA. Scenario: a client with a history of chronic constipation is admitted with complaints of abdominal pain, nausea, and no bowel movement for 5 days. Which nursing actions should the nurse implement? Select all that apply. A. Administer prescribed stool softeners. B. Encourage the client to drink warm fluids. C. Provide a high-fiber diet immediately. D. Assess for bowel sounds and abdominal distension. E. Prepare the client for diagnostic imaging as ordered. Correct answers: A, B, D, E. Detailed rationales. A. Administer prescribed stool softeners. Why correct? Stool softeners help soften hardened stool, facilitating easier passage. How it helps: relieves symptoms without causing excessive strain. B. Encourage the client to drink warm fluids. Why correct? Warm fluids can stimulate gastrointestinal motility, promoting bowel movements. How it helps: improves comfort and reduces the severity of constipation. C. Provide a high-fiber diet immediately. Why incorrect? High-fiber diets are not recommended during acute constipation as they may exacerbate symptoms by increasing stool bulk. What to do instead: address the immediate blockage first. D. Assess for bowel sounds and abdominal distension. Why correct? Abdominal assessment identifies potential complications such as bowel obstruction or paralytic ileus. How it helps: guides further treatment decisions. E. Prepare the client for diagnostic imaging as ordered. Why correct? Imaging may be necessary to rule out serious conditions such as obstruction. How it helps: confirms the underlying cause and guides management. Question 28, case study. Scenario: a client with diverticulosis reports mild lower abdominal pain and occasional rectal bleeding. What is the nurse's priority teaching point? A. Increase dietary fiber gradually. B. Avoid all fruits and vegetables. C. Take prescribed antidiarrheal medications daily. D. Restrict fluid intake to prevent further irritation. Correct answer: A. Detailed rationales. A. Increase dietary fiber gradually. Why correct? Gradual fiber increase prevents constipation and reduces pressure on the colon, preventing complications. How it helps: improves gastrointestinal health and reduces diverticular symptoms. B. Avoid all fruits and vegetables. Why incorrect? Fruits and vegetables are a primary source of fiber, which is beneficial in managing diverticulosis. What to do instead: encourage their consumption in moderation. C. Take prescribed antidiarrheal medications daily. Why incorrect? Antidiarrheals are not typically required for diverticulosis and may cause constipation, worsening the condition. What to do instead: focus on dietary management. D. Restrict fluid intake to prevent further irritation. Why incorrect? Adequate fluid intake is necessary to complement a high-fiber diet and prevent constipation. What to do instead: encourage adequate hydration. Question 29, SATA. Scenario: a client with gastroenteritis presents with diarrhea, abdominal cramping, and dehydration. Which nursing interventions should the nurse implement? Select all that apply. A. Administer prescribed IV fluids. B. Encourage the client to consume clear liquids. C. Provide a high-protein diet. D. Monitor electrolyte levels. E. Administer prescribed antidiarrheal medications. Correct answers: A, B, D. Detailed rationales. A. Administer prescribed IV fluids. Why correct? For fluids replace lost fluids and help manage dehydration caused by diarrhea. How it helps: prevents hypovolemia and supports electrolyte balance. B. Encourage the client to consume clear liquids. Why correct? Clear liquids help maintain hydration and are easy to tolerate for clients with gastroenteritis. How it helps: promotes rehydration without irritating the gastrointestinal system. C. Provide a high-protein diet. Why incorrect? High-protein diets are not appropriate during acute gastroenteritis as they may be poorly tolerated. What to do instead: focus on hydration and a bland diet. D. Monitor electrolyte levels. Why correct? Diarrhea can cause significant losses of sodium, potassium, and other electrolytes. How it helps: guides appropriate replacement therapy. E. Administer prescribed antidiarrheal medications. Why incorrect? Antidiarrheals are not routinely recommended in infectious gastroenteritis as they may prolong the illness. What to do instead: treat the underlying cause and manage hydration. Question 30, Case Study. Scenario: a client with a recent diagnosis of celiac disease is admitted with severe diarrhea, fatigue, and weight loss. What is the nurse's priority intervention? A. Administer prescribed antidiarrheal medications. B. Educate the client about a gluten-free diet. C. Encourage the client to increase fluid intake. D. Notify the healthcare provider of the client's symptoms. Correct answer, B. Detailed rationales. A. Administer prescribed antidiarrheal medications. Why incorrect? Antidiarrheal medications do not address the root cause of symptoms in celiac disease. What to do instead: focus on dietary management to prevent symptom recurrence. B. Educate the client about a gluten-free diet. Why correct? A gluten-free diet is the cornerstone of treatment for celiac disease, reducing inflammation and resolving symptoms. How it helps: prevents further damage to the intestinal lining and promotes healing. C. Encourage the client to increase fluid intake. Why incorrect? While fluid intake is important, it is secondary to addressing the dietary cause of the symptoms. What to do instead: emphasize dietary changes first. D. Notify the healthcare provider of the client's symptoms. Why incorrect? While it is important to communicate, the nurse can independently educate the client on dietary management. What to do instead: provide education and follow up with the provider as needed. Question 31, SATA. Scenario: a client is admitted with symptoms of appendicitis, including right lower quadrant pain, nausea, and a low-grade fever. Which nursing interventions should the nurse implement? Select all that apply. A. Keep the client NPO. B. Apply a heating pad to the abdomen. C. Administer prescribed IV fluids. D. Monitor for signs of perforation. E. Encourage ambulation to relieve pain. Correct answers: A, C, D. Detailed rationales. A. Keep the client NPO. Why correct? NPO status is essential in preparation for potential surgery. How it helps: prevents complications during anesthesia and surgery. B. Apply a heating pad to the abdomen. Why incorrect? Heat may increase the risk of rupture by exacerbating inflammation. What to do instead: avoid heat and focus on monitoring for complications. C. Administer prescribed IV fluids. Why correct? IV fluids prevent dehydration and support hemodynamic stability. How it helps: prepares the client for surgery and prevents complications like hypovolemia. D. Monitor for signs of perforation. Why correct? Perforation can lead to peritonitis, a life-threatening complication. How it helps: early detection allows for timely intervention. E. Encourage ambulation to relieve pain. Why incorrect? Ambulation is not appropriate for a client with suspected appendicitis as it may exacerbate symptoms. What to do instead: maintain rest and monitor for worsening symptoms. Question 32, Case Study. Scenario: a client with cirrhosis and ascites is admitted with increasing shortness of breath and abdominal discomfort. What is the nurse's priority intervention? A. Administer prescribed diuretics. B. Measure the client's abdominal girth. C. Elevate the head of the bed. D. Prepare the client for paracentesis. Correct answer, C. Detailed rationales. A. Administer prescribed diuretics. Why incorrect? Diuretics help reduce fluid accumulation but do not address the immediate respiratory distress. What to do instead? Focus on improving breathing first. B. Measure the client's abdominal girth. Why incorrect? Measuring girth is important for monitoring ascites but is not the priority during respiratory distress. What to do instead? Prioritize interventions that improve breathing. C. Elevate the head of the bed. Why correct? Elevating the head of the bed reduces pressure on the diaphragm, alleviating shortness of breath. How it helps? Provides immediate relief from respiratory symptoms. D. Prepare the client for paracentesis. Why incorrect? Paracentesis may be required but is a secondary intervention after stabilizing the client. What to do instead? Focus on alleviating symptoms before preparing for procedures. Question 33, SATA. Scenario: a client recovering from a colon resection is experiencing decreased bowel sounds, abdominal distension, and nausea. Which nursing interventions should the nurse implement? Select all that apply. A. Maintain NPO status. B. Encourage early ambulation. C. Administer prescribed antiemetics. D. Insert a nasogastric tube as prescribed. E. Provide clear liquids as tolerated. Correct answers: A, B, C, D. Detailed rationales. A. Maintain NPO status. Why correct? NPO status allows the gastrointestinal tract to rest and prevents worsening symptoms. How it helps: reduces complications like vomiting or perforation. B. Encourage early ambulation. Why correct? Ambulation promotes peristalsis and reduces the risk of paralytic ileus. How it helps: supports recovery of bowel function. C. Administer prescribed antiemetics. Why correct? Antiemetics alleviate nausea and prevent dehydration caused by vomiting. How it helps: improves client comfort and facilitates recovery. D. Insert a nasogastric tube as prescribed. Why correct? NG tube decompression relieves distension and prevents further complications. How it helps: reduces symptoms and prepares the client for further interventions. E. Provide clear liquids as tolerated. Why incorrect? Clear liquids are not appropriate until bowel function has returned. What to do instead? Monitor bowel sounds and signs of resolution before advancing the diet. Question 34, Case Study. Scenario: a client with newly diagnosed Crohn's disease is admitted with abdominal pain, diarrhea, and anemia. The nurse reviews the client's lab results: hemoglobin 9.0, hematocrit 30%, and serum albumin 2.8. What is the nurse's priority intervention? A. Administer prescribed iron supplements. B. Educate the client about nutritional supplementation. C. Notify the healthcare provider of low albumin levels. D. Administer prescribed IV fluids and electrolytes. Correct answer: D. Detailed rationales. A. Administer prescribed iron supplements. Why incorrect? Iron supplementation addresses anemia but does not address immediate concerns related to dehydration and malnutrition. What to do instead? Focus on fluid and electrolyte balance first. B. Educate the client about nutritional supplementation. Why incorrect? Education is important but not the priority in an acute setting. What to do instead? Stabilize the client first and provide education during follow-up care. C. Notify the healthcare provider of low albumin levels. Why incorrect? Although low albumin levels indicate malnutrition, notifying the provider is not an immediate intervention. What to do instead? Correct the acute issue of dehydration and electrolyte imbalance first. D. Administer prescribed 4 fluids and electrolytes. Why correct? Clients with Crohn's disease often experience dehydration and electrolyte imbalances due to diarrhea and poor absorption. How it helps: stabilizes the client's condition and prepares them for further treatment. Question 35, SATA. Scenario: a client with a history of peptic ulcer disease presents with sudden sharp abdominal pain, hypotension, and absent bowel sounds. Which nursing intervention should the nurse implement? Select all that apply. A. Keep the client NPO. B. Administer prescribed antacids. C. Prepare the client for emergency surgery. D. Monitor for signs of septic shock. E. Place the client in a low Fowler's position. Correct answers: A, C, D. Detailed rationales. A. Keep the client NPO. Why correct? NPO status prevents further gastric secretion and prepares the client for surgery. How it helps: reduces complications during and after surgery. B. Administer prescribed antacids. Why incorrect? Antacids are not appropriate for suspected perforation and do not address the emergency. What to do instead: focus on preparing for surgery. C. Prepare the client for emergency surgery. Why correct? Symptoms suggest gastric perforation, requiring immediate surgical intervention. D. Monitor for signs of septic shock. Why correct? Perforation can lead to infection and septic shock, requiring close monitoring. How it helps: early detection ensures prompt treatment. E. Place the client in a low Fowler's position. Why incorrect? The client should be positioned to minimize pain and reduce aspiration risk, but this is not the immediate priority. What to do instead: prepare the client for surgery and monitor closely.